In this video, I'm going to show you how to do joint mobilizations on the MCP and IP joints. To do that, first put them in the resting position. For the MCP joint, which is the joint between your metacarpal and your proximal phalanx, that is slight flexion. This is just pretty much a comfortable position for patients. Tell them to relax their fingers and they usually will go into that position. So I'm going to show you here on the second MCP joint. I'm going to stabilize the metacarpal and mobilize the proximal phalanx. First, I'm going to do distraction to examine the mobility of the MCP joints. So you just apply a traction force. This is an examination for hyper or hypomobility. Then you can intervene, putting the MCP joint in its point of restriction and apply traction at that point. The MCP joint is a concave proximal phalanx on a convex metacarpal, so the roll and glide will be in the same direction. So when we intervene, keep that in mind. I'm going to start with a palmar glide. So again, I'm going to distract the proximal phalanx, push the proximal phalanx palmarly, applying graded oscillations. This is going to help treat restricted flexion at the MCP joints. Then I'm going to apply distraction, push the proximal phalanx dorsally. That is for restricted extension at the MCP joints. For restricted radial deviation, or I guess in this case it would be abduction, I'm going to apply a traction force and then push the proximal phalanx in a radial direction for restricted abduction of the second MCP joints. And for restricted adduction of the second MCP joints, I'm going to apply a traction force and push the proximal phalanx in an ulnar direction. All of these positions I'm applying graded oscillations. The same principle can be applied to interphalangeal joints. Grab the proximal phalanx, stabilizing, apply traction on the phalanx distal to that, and move it in a palmar, dorsal, radial, and ulnar direction. At this joint as well, it's a concave distal segment on a convex proximal segment, so the roll and glide are going to be in the same position. That means that palmar glide will be for restricted flexion, dorsal glide for restricted extension, and there's not much motion in abduction or adduction, but you can move it all around in those ways.